And so now it's going to be a really special honor now because we get to hear about a very important topic that has become a big ticket item for Volunteers of America as a national organization, and that is moral injury. And we have here an in-house expert, Dr. Rita Brock, who is going to give us some information around moral injury. Dr. Brock.
Okay. So I'm going to begin by asking you, who taught you to be a moral person? Parents, teachers, ministers. What else? Siblings. That's the first time anybody's ever said siblings. I'm the oldest, so I think that too, but nobody ever says, nobody ever, my sister probably wouldn't say that. Other people who taught you to be moral? Friends? Neighbors? Actually, it's everybody in our world of relationships we learn behavior from the time we're born, right? And that's how we also know that we're a moral person, is that they like us. I mean, this is part of being part of a social world where you're valued and appreciated, is you learn how to be moral. So what happened, like maybe when you were a kid or in high school, when you did something wrong, you knew it was wrong. It may have been by accident, or you may have even done it on purpose. So how did you feel if that happened to you?
Shame.
Shame?
Guilty.
Guilty?
Embarrassed.
Sad, embarrassed? Any other feelings?
Conflicted.
Conflicted? Maybe a little remorseful? If you did it on purpose? Especially if you got caught? So people talk about those feelings as moral emotions. Right? Because they come because we can evaluate our own behavior morally. Just like we evaluate everybody else's behavior morally, most of us do that all day long without even noticing we're doing it. Because being moral is such a habit by the time we're old enough to think about it, that most of the time we don't think about it. You know, it's really simple. If you're standing in a line and the person in front of you turns around for some reason and lands on your foot and it hurts and you go, ow, what do you expect? An apology, right? Because a normal moral person wouldn't even have to think about it. They would just say, oh, I'm so sorry, right? But what if the person didn't apologize? What would you think? Bad person, rude, jerk, you know, all kind. You would automatically, not even really thinking it through, you would just automatically make a moral judgment. And we do that in micro moments. I said we just do that all day long. It's just the way we're moral because we're habitually moral. And every society has codes of conduct around that, and people learn it and they don't think about it. So you can actually violate something, you can violate that habitual moral code without even thinking very much about it. Like you do step on somebody's foot and you do apologize, but you actually broke their foot. That's an awful feeling, right? I would feel terrible if I did that, because of course it'd be medical bills. But we just you know, we don't like to cause that kind of relationship with people. Because life is much smoother when we just kind of go and do the right thing all the time without thinking about it. So most of the time when we're thinking about something, it's because we're not sure, right? It's like, well, should I do this or should I do this? Because you can get to a place where an automatic behavior doesn't work, like something you habitually do. So suddenly you don't get a paycheck for 6 weeks. And you have to decide whether you're going to pay the full amount for your child's diabetes medicine or pay your rent. That's a horrible moral dilemma. But a lot of people in the country face those kind of choices in the last 6 weeks. And there was a story on NPR about a woman who with giving her daughter a quarter dose. It wasn't related to the government shutdown, but it was related to her not being able to pay for the medicine, and the daughter died. She didn't know that was going to be the consequence of trying to save money on the medicine. So she didn't kill her daughter on purpose. But imagine what the rest of her life is going to be like. Imagine. She didn't deliberately kill her own daughter. It wasn't a purposeful act. And yet, if it were me, I'd feel like I killed my daughter. So this is how life is for us as human beings. We don't live in a perfect universe, and sometimes our lives get caught in a situation where we have to make a choice where there's no good choice. That's just, and the longer you live, I think, the more you wind up facing those kind of choices. So we all struggle with these moral questions, and most of us get through it by having like a religious system or a support system or friends who can help us talk it through so we can figure out what we're going to do with this dilemma or this act so that we can keep living forward in our lives. So people that work in mental health call that kind of stress from facing difficult moral dilemmas moral distress. So, and we all live through it, but if we can keep moving, if we've got healthy relationships with other people and we can keep talking about it, then we can integrate that moral distress as lessons in our life and we can keep moving. So, but imagine that you're in a situation where, I'll tell you a story of a veteran. He was the commander of a little checkpoint where cars in Iraq had to come through and be inspected to, for weapons and explosives before they let the cars through. So he wasn't at the check stop, he was in the command station. And his guys radio back, "We got a car coming, it won't stop." They yell in 5 languages, "Stop, stop, stop." And the car didn't stop. So he said, "Well, do warning fire." So they shot at the car's warning fire. They didn't want to kill anybody. And the car kept coming. And it kept coming and it wouldn't stop. And they didn't know why it wouldn't stop. But generally it means it's got a bomb in it. And they're trying to blow the station up. So he gave the order to blow the car up. So they shot a little missile and the car blew up and it burned. So when they could go inspect it, they went to find what weapons or explosives might have been in the car. That was the reason it wouldn't stop. And what they found was a family with 3 children in the back seat, a man and a woman in the front seat, and 3 children in the back seat. They were all dead. And there were no weapons. They couldn't find any reason for why they didn't stop. And to this day, no one knows why, because they all died. But he felt so terrible killing a family like that they clearly were confused, or they thought if they hurried they'd be safe. Who knows? But when he got home, he felt so bad about it that he refused to eat dinner with his family. And when the person was counseling him, talked to him about why wasn't he eating dinner with his family, he had decided that what he had done was so horrible that he didn't deserve to have dinner with his own children, that he didn't deserve to enjoy his own children. He had a case of guilt and shame and remorse and all of those moral feelings so profound, it was wrecking his life. That's what moral injury is. And the first research was done with veterans like this person who killed that car full. He gave the command, he felt he was responsible. But there is new research now in a whole lot of different parts of society on medical doctors and nurses and emergency. But when Corey and I were in New York a couple of weeks ago teaching a course, we had a chaplain from the New York Fire Department. She said, we got to deal with this. She was just very clear that was a major problem in the fire department in New York. So it's not limited to veterans. Veterans was the first place the research was done because, of course, their job is to learn to kill. They may never go to war, they never ever have to kill someone, but if they do, war rarely follows the rules. So, but that's true now of more and more professions. The medical doctor, I was talking to a doctor who was setting up a self-care for doctors program for a new medical school in Fort Worth, Texas, and he came, somebody told him to come talk to me about moral injury because he was setting up the curriculum for the medical students on how to take care of themselves as they go into medicine to do medical work. And I said, well, you really do need to add a moral injury piece. And he said, tell me what moral injury is. So I said, well, let me just give you an example. Say you have a brilliant ICU nurse that's just, been at the hospital for 20 years, and this particular nurse is just a really special, really good nurse because they're so caring about the patients and they're so dedicated to the work. And you have a new doctor that just came out of a major research program and, has all the latest up-to-date knowledge of research, and the doctor decides to do a procedure on one of the patients in the ICU. And the nurse, from 20 years of experience, thinks not a good idea, that this nurse is pretty sure that is not a good thing to do for this particular patient. And the nurse might even say that to the doctor. And the doctor says back, no, I know we've done this research study and this is what we need to do. And so the nurse is required to administer the treatment and the patient dies. And I said, you are at risk of losing one of your best nurses. Because if they can't reconcile their sense that they killed the patient with their sense of being a good nurse, they will leave the profession. Think about all the years invested and the knowledge that that hospital would lose in that particular incident of that nurse being devastated. And not feeling like, because of course you either have to obey the doctor or get fired, or take the risk, and then even when you know it's not right. And so that nurse made that choice, and so he looked at me, his mouth fell open, this doctor who was setting up this program, his mouth fell open, and he said, I had a case like that 2 weeks ago. So he got it immediately, right? So we talked a little bit about moral injury and stuff after that, and he was then very interested in what was moral injury. And I've had that experience of somebody coming up to me every time I talk about this and saying to me, do you think like lawyers could have it? Or do you think like school teachers could have it? It's amazing how many people have come up to me and asked me that question. And I know when they're asking me that question, that is their profession and they have a case of it. Because if I say, why do you ask? Then they want to tell me, and they may not have ever told anybody. They've just been carrying it as something that made them miserable for years. And so moral injury is when something happens to you that steals your sense that you are a good and reliable person. And when you don't feel like you're a good or reliable person, I've heard people say, I became evil, or I feel like I have an evil twin inside me that I did those things. That you have to figure out how to help people process this tragic and awful or horrible thing that happened to them so that they can begin to get enough perspective on it that they can let it become something that informs their life rather than running their life. In other words, if you have something that major happen to you and you feel like you're not a good person, you become despairing, you may start drinking, you may overwork to try to forget, you may be doing things because the pain of it is more than you can attend to, but it keeps haunting you. And so people's relationships break down. They may lose a career they invested 50 years of their life in. They may become homeless, or they may drink too much, or they may work so hard they work themselves to death rather than face that pain. Because it's a pain you can't face alone. You didn't become moral alone, so you can't think your way back to being moral without starting to establish relationships of trust where you can talk about and process this stuff. So that's how I understand myself when I think about and try to tell people what moral injury is. It can really wreck a life, and because it can wreck a life, it can wreck a family, a community, it can wreck a company. I mean, it's a toxic kind of pain that people carry. And there's two ways it can happen to you. And I'm going to end with this because these are sort of countervailing definitions or sort of ways of thinking about moral injury that are both and, but sometimes also either or. And the earliest definition of moral injury was that you had someone you trusted, someone that your life depended on, and that person should have done the right thing in a really high stakes situation and did not do the right thing, and you got harmed. So your distrust, you don't trust yourself to trust people because you trust or love somebody and then they hurt you to the point that it wrecked your sense of being a good person, or it wrecked you to the point you're so angry you can't live without that anger. And that's called betrayal. It's being betrayed by somebody who should have done the right thing. And I think that is a serious kind of betrayal you find in people who have had difficult family environments where they were traumatized by their parents or by people that they loved. It can happen in the child welfare system with social workers who try to do the right thing and then harm a child, and that child feels betrayed by the system, by their family, by everybody else. So betrayal is a huge piece, and it often comes loaded with a lot of frustration and anger. Because you're angry at the person for hurting you, you may be angry at yourself for trusting that person, or you may have even decided that you were bad and deserved it. You may have moral judgment about yourself instead of the person who harmed you. That's one kind of moral injury. The other kind is you did the harm. You actually did something, sometimes on purpose, sometimes by accident, but you might have taken a life, or you might have put a child at risk by some work you had to do, and then that child wound up with a foster family that killed it. And you were the social worker that put the child there. So there are all kinds of ways in life where we wind up making a huge mistake or failing to prevent harm. You can even be traumatized and develop a case of moral injury by hearing about somebody you thought should have done the right thing and they didn't. And you could feel betrayed in the secondary ways. And if you're working with people with moral injury, you can also feel their anger. You can feel, because these feelings, we share them as human beings. And so part of the work we're doing now, right now, with Volunteers of America, is we have this project funded by Bristol Myers Squibb, where we're working with military veterans and helping them process moral injury. It takes about 60 hours. And I think the secret sauce in the program, the thing that makes it work so well, because we're now seeing the results, is it's peer specialists. It's people that they know won't judge them or think less of them if they really tell what happened to them, what the moral injury trauma is that they're carrying. And that is the secret sauce. If you can't establish a relationship with somebody that you trust enough to process what's happened to you, you're never going to be able to process it. And if you can't process it, then it will just be the ghost in your system, your emotional system, that haunts you and haunts you and haunts you until you take care of it or until you die. So that's why I think Mike got so excited about this, because I agree with Mike that that moral injury work has to be infused into everything we do when we're dealing with people who are carrying any kind of life difficulty and trauma. It's really, really important to know what it is and be able to recognize it and help people find the people they need to help them process it. So thank you.
Thank you.
Yeah.